It's a problem that's not going away. This World AIDS Day, UNICEF wants to reinforce the message that attention and prevention are still needed. A new report from the UN's Children's Agency shows it will not achieve 3 of its so-called super fast-track targets by 2020. Eliminating mother-to-children transmission, reducing the number of new infections among adolescents, and providing nearly 2.5 million children and young people with treatment. The report also says that progress has slowed because the world's attention has moved elsewhere.
There is a lot of complacency that has settled in. We are victims, perhaps, of our own success. There is a problem both with the public sense of the state of the epidemic, but also from donor governments and from funders who see this now as less of a global priority.
The area of greatest concern remains on the African continent.
Sub-Saharan Africa is the epicenter of the global AIDS epidemic. So any action we take there will have the greatest value in terms of reducing the numbers.
9 out of 10 HIV-positive women and children live in sub-Saharan Africa, with the region also accounting for 9 out of 10 adolescent AIDS-related deaths. And there is another area of concern. Data from UNAIDS shows that men are less likely to take an HIV test and seek treatment, and therefore more likely to die as a result of AIDS-related illnesses.
We need to understand that more deeply in order to really break transmission. And as new data become available and we understand the context of HIV in these different contexts, we're able to tailor our programs and our responses to that. And what this report is saying is we mustn't forget the particular cases of men and boys and have services that are tailored to their needs.
But fears remain about the possibility of the US government cutting $800 million from AIDS funding. Advocacy groups warn the reduction would result in over 4 million deaths and 26 million new infections in sub-Saharan Africa over the next 15 years. Even so, the UN believes there are still reasons to be optimistic. For the first time globally, more than half of all HIV patients now have access to antiretroviral drugs. Harper, CGTN, New York.